Good morning. My name is Renee Franklin. I'm a student at UDC, and this video is for my oral communications class. I want to talk about Children's National Hospital and the safeguards we've set up in reference to COVID-19. And as we know, COVID-19 virus, also known as the coronavirus, has become a pandemic. This pandemic is affecting us in many, many ways, but there are avoidances that we can establish to help deviate the spread of this virus. So Children's National has set up some protocols and safeguards concerning, number one, visitors. Patients are only allowed one visitor per entrance into the hospital. So if you're coming to the clinic or if you have to come in as an inpatient, you can only have one parent per child during that visitation. And this is to avoid, the spread of the virus. Also, we are taking temperatures upon entrance into the building, and this protocol is set up for both patients and hospital staff. Everyone will have their temperature taken because an elevated temperature is one sign of the virus. So we want to avoid those patients coming in who already may be exposed to the virus. We're also kind of working with Georgetown Hospital because our clinics work together. So Georgetown Hospital has also set up a protocol where everyone is being screened prior to entering the building. They have come up with an idea of wristbands. So we're color coding these bands to identify employees, whether you work for non-clinical or clinical establishments. Your badge is color coded based on your work area. Also at Children's Hospital, we're doing ID tags. So the ID tags have red dots or blue dots, and that will establish where you work in the hospital. Our environmental services are really working hard and diligent to avoid the spread of this virus. They're sterilizing every room. Every room is overly sterilized, basically, to ensure that this virus has not been spread. All equipment is being wiped down, all windows, doors, walls, floors. They're going above the norm and they're cleaning to assure us that this virus is being combated. So we also have extended our occupational health areas. The occupational health clinic is open extended hours for employees who may have been exposed, and our employee assistant offices are working diligently with employees to ensure your security. If you have anxiety or stress, or you're dealing with a family member that's been exposed to the virus, we are helping you work through those issues by teaching you how to isolate yourself during your time of consecration while you're at home after you've been exposed or someone in your family has been exposed to the virus. We've also set up more teleworking. Georgetown also has shut down their outpatient clinics, and all of their employees are working from home and scheduling patients through the MediTele system. At Children's, we're doing televisits also for our patients so that you won't have to come into the clinic. But if you're scheduled for an emergency surgery, we are doing emergency surgeries. Also, what we're doing is working very hard with neighboring hospitals. We've now opened up our doors to allow children from ages newborn to 29 years of age to come to Children's Hospital. And this is allowing the other neighboring hospitals not to be so burdened down, because these hospitals are filled to capacity. And if we can take the weight off of some of those hospital beds, we're bringing the kids into our hospital. So I hope this video has helped you be more comfortable and more aware of the protocols and guidelines that we set up at Children's National, and you will be happy with visiting our facility knowing that you're safe. Thank you for your time. Bye.